Frostnip. Frostnip is the mild, earliest stage of freezing injury that affects the top layer of skin and usually shows up on exposed parts like fingers, toes, ears, nose, cheeks, and chin. The cold makes small blood vessels tighten so the skin feels very cold and may turn red, pale, or blotchy. You may notice stinging, tingling, prickling, or brief numbness that can begin within minutes to a few hours depending on temperature, wind, and wetness. Frostnip itself does not cause permanent tissue damage if you stop the cold exposure and warm the area quickly and gently. First aid is to get indoors, remove wet clothing, and warm the skin with body heat or by soaking the area in warm water around 37 to 39 degrees Celsius for about 30 minutes until feeling returns. Do not rub or massage the skin, do not use direct heat like a stove or heating pad, and avoid very hot water because numb skin can burn and friction can further injure tissues. People at higher risk include those with wet clothing, poor circulation, heavy alcohol use, certain medications, or long exposure to wind and low temperatures. Seek medical care if the area does not regain normal color or feeling after warming. Also see a doctor if it becomes hard, remains numb, or if blisters appear. Severe color changes or signs of infection are other reasons to get medical help. Frostnip can progress to true frostbite, which can cause blisters, deeper tissue injury, and long-term problems if not treated. Superficial frostbite. Superficial frostbite is a deeper freezing injury than frostnip that affects the skin and the layer just under it. The skin often looks pale, waxy, bluish, or purple and can feel firm or slightly stiff to the touch. When you begin to rewarm the area, it can paradoxically feel warm and sting, burn, tingle, or ache. This happens because damaged small blood vessels leak and inflammation starts. The area commonly swells and clear fluid-filled blisters usually form within about 12 to 36 hours after rewarming. Treat this promptly by getting out of the cold, removing wet clothing, and gently rewarming the part in warm water around 37 to 39 degrees Celsius if there is no risk of refreezing. Do not rub or massage the frozen skin as friction can cause significant additional damage to the skin cells and fragile underlying tissues. Protect the area from refreezing. Keep it clean and raised to reduce swelling. Use pain relief if needed and see a doctor for large or worsening injuries, ongoing numbness, infection, or blisters, as these may need treatment to prevent lasting damage. Deep frostbite. Deep frostbite is the most serious kind of freezing injury. It destroys the skin and the deeper layers beneath it, including fat, muscle, joints, and sometimes bone. Freezing makes ice crystals inside and between cells and damages tiny blood vessels, which stops blood from reaching the tissue. The injured area quickly loses feeling, so you may not sense pain, cold, or touch. The skin often looks pale, gray, or blue and feels hard, wooden, or waxy. After warming, large blisters often appear within 1 to 2 days, and these blisters can be filled with blood. Over days or weeks, the damaged tissue can die and turn dark and hard. This dead tissue is called gangrene. If bacteria get into the dead tissue, it can become wet gangrene where the tissue decays. Deep frostbite raises the risk of severe infection and long-term problems such as ongoing pain, numbness, loss of function, and the need for surgery or amputation. Immediate medical care is required. In hospitals, doctors carefully rewarm the area when there is no risk it will freeze again. They give strong pain relief and do wound care. They use scans and circulation tests to see how much tissue is damaged. If blood flow is blocked, clot-dissolving drugs called thrombolytics may be used. Doctors may also use medicines called prostacyclin analogs that widen blood vessels and help circulation. Tissue that does not recover may be removed surgically or amputated. After that, most patients need rehabilitation and ongoing pain control. If you like this video, subscribe for more.